And public health consultant Dr. Nseabasi Ekanem joins me on the news from Lagos via Skype. Good to have you join us, Dr. Nseabasi Ekanem.
Good afternoon.
So this is the case in Indonesia is almost like what we saw in India. At first there is a lull, and then it looks like everything is fine, and then we see this spike in cases as a result of a particular variant, and then oxygen shortages, hospitals are overstretched. Talk to us about how this plays out.
One of the things that we have noticed with the Delta variant of COVID-19 virus is the fact that it doesn't manifest clear symptoms when the person is infected. And that is one of the reasons why most of these countries, like you mentioned, India and Indonesia, most recently, they're suffering from a surge in these cases. Never knew that this is coming because most of the people who were infected with the Delta variant did not manifest symptoms on time. I mean, according to the normal disease description for COVID-19. And that is why you see that when the whole thing blew open, and being the fact that this particular variant is much more deadly, the number of severe cases that come forth from this Delta variant is much more than the episodes or the variants we've seen before. That is why you're seeing the acute need of oxygen in these countries. But I will draw you an example to what happened in Nigeria, somewhere in Enugu, around September and October last year. We observed that there was an acute surge, of course, in COVID-19 cases. And we saw what happened in Enugu in the University of Nigeria Teaching Hospital, where the gas plant wasn't working. And so patients had to go and source for their own, oxygen tanks. And there is a pointer that we might be experiencing something like that in Nigeria. And what does that tell us? We need to improve our preparedness and response plan. Should this Delta variant, which is already in Nigeria, of course it has been detected in Nigeria, in case it happens, how prepared would we be? We need to start thinking. Because we have seen what is happening.
Dr. Ekanem, I would get to preparations soon, just shortly, but you mentioned that this virus doesn't, it's not the same as the previous variant where, within 2 weeks, there's a manifestation of symptoms. So what really should we be watching out for?
Well, what we should do right now is to beef up testing. Because like I told you, it doesn't really manifest much of that symptom early enough. So it doesn't give us that chance, to start monitoring for maybe signs and all of that. So we need to improve testing so that we can dictate the virus even before symptoms begin to manifest. There's need for us to ramp up testing. We need to increase testing at different sites. So all those testing centers that we had before now, we need to reactivate them. And it should be made free. The rapid testing should be made free so that everyone who is willing to go for testing can have the test carried out. And we should even encourage more people to go for the self-testing so that people on their own can test and know whether they have the virus even before symptoms start manifesting, so that we will limit the severe cases to cases that we can manage in the hospital, while the mild cases can be managed at home with isolation.
So there are countries where you can basically, if you do not want to fall sick, you have a choice. You walk into a vaccination center and get vaccinated. But there are some countries like Nigeria where that is not an option. Vaccines are limited, not because there is no vaccination ongoing, but because these vaccines are limited. So in what other areas, you've talked about testing, what other areas should we begin to ramp up or beef up capacity if we're going to avoid or minimize a third wave?
Okay, well, I think what we need to do is, first of all, we need to re-communicate to the people. I know a lot of Nigerians have actually laid down their guards. It's obvious everywhere. You go to a lot of public places, you see that people are no longer observing the social distancing, the face mask wearing, and of course the hand hygiene. So we need to reenact the message and re-encourage Nigerians that, look, we have a new variant. And this new variant means that we need to go back to those public health measures, those non-pharmaceutical measures that we were adhering to earlier on. So we need to get people to observe them and to do it to the letter. And again, we need to also make sure that we beef up public-private partnership. What do I mean by this? like what is happening in Indonesia now. We need to work with the private sector, so that we can increase our own preparedness in case these things happen. For example, what is happening in Indonesia, you see, they run out of gas, oxygen. All right, we need to make sure that we identify these people who are into this business and make sure that we have them prepared should we have this Delta variant, while we build more communication and get more people to start observing the non-pharmaceutical caution against COVID-19.
All right. We hope that the government is doing exactly what you said. The third wave might be imminent. Hopefully, we can minimize the number of cases and deaths. Public health consultant Dr. Nseabasi Ekanem, thanks for talking to us.
Thank you for having me.